you talked a lot about, and you do in your social media as well, talk a lot about physiological levels of hormones. And this is a controversial topic too. Some people say it's too much. Other people say we're always going so low. Why do we need to get physiological levels of hormones? Maybe explain what is physiological anyways.
It really refers to the hormones that a woman has and levels that she has when she is young and healthy. We don't see a 25 or 30-year-old coming down with osteoporosis or heart disease or dementia. So that's what we're referring to, those levels. And then why do women need them? Well, I'm going to start with this, and that is they feel better. They feel a lot better, right? They don't typically, I know maybe the case is a little different for you, and I'm not saying this is only related to hormones, but they don't have joint pain. They don't have hot flashes. And Kristen and I will speak to so many women who are on HRT. They'll get a diagnosis of osteoporosis, and they'll be like, why? I've been on the patch. I've been on the, 0.0375 patch for 10 years or what have you. And why do I have osteoporosis? And I've done everything right.
If we talk about, even the premise of the book is saying that our hormones were regulating multiple biologic processes around the woman's body our entire lives, from puberty onwards, once we had these robust amounts of hormones. So our position is, if we know, which we do know, that as we lose these hormones, we essentially lose the stimulation needed for those biological processes. This leads to disease states for women. Why is that okay? Why is it okay to deprive women of the levels of hormones that would prevent reaching those disease states due to a lack of hormones? So that's the issue, is we have physiologic levels. It's not just, oh, it's the level that a 30-year-old had. It's the level that was making sure that 30-year-old didn't get osteoporosis and heart disease, like Maria said. So why is it okay to not give a woman those same levels as she gets through menopause? And it's based in this whole, well, you only need enough to essentially stop your symptoms, meaning stop you complaining, right? That's what they mean. And even the WHI understood that the medical system recognized replacing women's hormones as a means of disease prevention. This goes all the way back to the early 1900s. Every medical society recognized it, et cetera. Now, the problem was obviously with the WHI is when they decided to test this theory finally and say, do we know for sure? Do we really get these hormones to prevent disease? They, A, didn't actually use hormones. They used synthetic drugs. And B, they worked on women who already had disease. So that's why that was a colossal failure. But if we just look at what it has always been well accepted, that if you were 29 and you had no cycle, even if you went to the doctor and said, it's okay, I'm not interested in having kids, I don't need my menstrual cycle to return, that doctor would still say, no, we're going to put a patch on you or some cream or even give you oral estradiol because your bones are at risk. So that argument is used when women are younger, and yet it is completely ignored and in fact dismissed when people are older. It even goes to the manner of delivering hormone replacement therapy to women is very much scoffed at when it's suggested that you mimic the manner that those hormones were produced when we were younger. We've got a very prominent male OBGYN on the social spheres who will literally just crap all over this and say, women don't need their menstrual cycle back. No one's saying we're doing it to get the menstrual cycle back. What we're doing is to get the stimulatory responses and catalyst triggers in the body, because that's what they were doing all along. And that's kind of the fundamental, I think, misunderstanding about menopause, is that it's captured as it's just this loss of the menstrual cycle. It's like, no, the menstrual cycle was just one thing that was involved in the whole rhythmic dance of hormones. What was really going on was keeping the female body healthy.
What our physiological levels look like in terms of range? So we're not talking about how much of a dosage you should be taking.
Right.
We know that every woman is absorbing differently. So
Right.
what are you looking at, for example, in estradiol? What's the range that you recommend to get a woman in to protect her bones?
I think we have to almost stay away from ranges because we don't know what, Zora's day 12 peak was of estradiol when you were 30 versus Kristen's versus Maria's. What we do know for sure is that the lowest level of estradiol tends to be in the second half of the luteal phase of a woman's cycle, right? That's when estrogen's on its decline, right before they get a menstrual period. What's the average level in that luteal phase? It's about 125 to 150 picograms per ml. And I know you've got a lot of international listeners, but I don't have the international conversion in my head.
Yeah, okay. In Europe, we use picograms.
Okay. So
I
yeah,
mean, we
so
do have lower levels in the first few days, but just generally those are very low. And
That's when
women don't feel well.
yeah.
right.
That's
Yeah, when you're bleeding.
Yeah. And that's when you're premenopausal, when you're fertile, or this is
Correct. If you could accept that at about 125 to 150, below that, the wheels start to come off. This is when you're going to have physiologic changes, biological processes are going to be disrupted and interrupted, et cetera, et cetera. That's whether you're premenopausal or postmenopausal on HRT. So we would posit that that's about a baseline, that a minimum that you would want to be at. Now, whether or not a woman wants to go up and down during her cycle, just the way estradiol naturally went up and down, that's a whole nother discussion. So if you look at a day 12 peak, you're talking anywhere from 300 to 500 or higher picograms per ml. Now that's only on a day, right? So you're not dosing that every day, and we're not suggesting you're dosing that every day. But if you were to try and mimic that cycle, that rhythm that of output that occurred premenopausally, you would kind of have this baseline around the 125, 150, and then you'd bump up at a certain point in the cycle or come down. For those women who do static, same dose every single day, we would take the position that below 125 or so, you're at risk. That you will not have the same robust bone remodeling. You might prevent your already established osteoporosis from getting worse, but you're not going to recover that bone. You can recover it at higher levels because we start to stimulate the osteoclasts and osteoblasts.
You're working with a lot of women in your community, and you're looking at a lot of blood work. And so when do you see a woman where she's too high? You go, okay, well, wait a second. That's what number is that?
500 to 800, sometimes 1,000.
Some women feel good at 500, but again, only a couple days. They're not there the whole time. Yeah. If you're at the 300s every single day, that's probably going to be problematic because that's kind of a proliferative state. You can get receptor overwhelm where you get such a high level, whether it's persistent or over a couple days, that your receptors sort of shut down. It's a protective measure to be like, that's a little much for me. And so women will feel low estradiol during that time, even though they might have blood lab levels of like 1,000. And so that's just an overwhelmed situation.
A woman who's doing the rhythmic cycle, let's say, of estradiol, because the progesterone is quite common for women to go on days 14 to 28 of their cycle, or mimic that cycle if they're not cycling. But it's less known about cycling estrogen.
We totally get why you want to say cycling. We don't cycle estrogen.
You're not cycling estrogen. It sounded like that's
what you're referring to is using it rhythmically.
So cycling is on-off. And you never take a day off of estradiol. So that's why we don't use cycling with respect to estradiol, but on-off progesterone, we cycle it. So yeah, it's a rhythmic.
I meant to say rhythmic. Yeah.
And a day 12 rhythmic, if you're using physiologic, a day 12 rhythmic could be 350 to 550. But again, it depends on where a woman feels best. When I go below 200, I get migraines. My knees feel like they are bone on bone and I'm going to die. And I want to just peace out on this earth.
Yeah.
That's just me. Some women are great at, say, 125, 150. But for me, it's more 200 is kind of my lower tolerance. So every woman's different.
But then how are you measuring what they're getting on because you have to do it for how many days, testing for how many days to figure out actually how much are they absorbing during this?
You check on your day 12 peak and you check on your day 21, which would be your peak of progesterone.
But what about all the time in between?
You don't necessarily need to know every single day, and that would be kind of unwieldy at that point. So when you test progesterone on day 21, you can also run estradiol and, again, about 125 to maybe 250.
Yeah, you're not dosing the same amount every day. Day 12 is your peak dose if you're doing physiologic restoration. So a day 12 peak dose, you check your level on that day. But the other thing too is labs aren't the end all be all. And we are totally against NAM's position that women don't need to have labs drawn. That is an absolute load of crap and shame on them. Hormones are incredibly powerful molecules. So for any doctor to be dosing hormones and never checking blood labs, it's, my opinion, malpractice or negligence at the very least. But you got to be talking, the provider has to be talking to the woman. How do you feel? How do you feel, Zora, on your day 12? Is your sleep disrupted? Is it too much? Is it too low? Could you go a little higher? Should you be lower? So, your dosing regimen is going to be this sort of nice building peak, and then there's a taper down, and then there's maybe a slight bump. You're mimicking essentially if you pulled up a graph of the menstrual cycle and looked at our hormone output. So the dosing tracks that. So if you're really worried about high amounts, you're really just looking at that day 12 peak.